Thank you for joining us for this fifth module in the five-part series. I'm Paul Karpecki. I practice at the Cincinnati Eye Institute in cornea services and ocular surface disease research. This last part could be as important as anything we've talked about. It's really how do you get started? How do you implement this into your practice? What steps do you take to get to the next level? I really believe that the future of optometry is going to advance through maintaining our core, which is contact lenses, spectacles, primary eye care, and it's stepping into the medical model. I believe this part really will enhance our core level. They say that every day from about 5 years ago till the year 2014, a minimum of 10,000 Americans turn 50 every single day. The most common pathology that they have is ocular surface disease. So for the next 2 decades, this may be the most important aspect of our practice, maybe the most important thing that you implement into your clinical care as an optometrist of the future. And so with that, I'll pass it over to Doug, who will take you through the key points of getting started.
I'm Doug DeVries. I practice at Eye Care Associates of Nevada. It's a statewide co-management center. One of the most important aspects is when you get this, you gain this information, you gain this knowledge, is how do you go about implementing your practice? Because I think we all go to different meetings, to different congresses, and we come home and we're pretty enthused and we're excited. But then day to day, how do you implement it and actually get going in your practice? And that's some of what we're going to cover in this fifth and final module today. With patients, there are multiple etiologies of chronic dry and therefore multiple treatment modalities. So of course there has to be the element of reappointment. I think one of the things that we have done as a profession is we try to do too much in one visit. And as a result, what we quite often do is end up giving away our services. So in looking at implementation into practice management and how do we get that patient, staff is going to play a very key role, because when you change your private practice, when you change the way you practice, the way your staff practices, you absolutely have to have staff buy-in. And as they understand that you're going to move into a different direction, that you're taking care of the core of our profession, which is spectacles and contact lenses, but you're broadening out into a therapeutic subspecialty, they'll understand the value also of bringing that patient back, just as any other provider would be, to see how that treatment regime is going. So in order to be able to do that, what you need to have is you need to have some forms ready. To make that switch over, you need to start off with the very basic, and that is the symptoms a patient has. So you have to have a questionnaire. Now there's several different questionnaires that are available on the Odyssey website that you can implement. They're in PDF format. You can then put them on your own stationery, your own letterhead. And to have a good case history and to be able to go through and know what the signs or the symptoms are of those patients. The next thing you need to do is you need to have a written instruction. You're going to overwhelm a patient with information during that first visit as you go through the diagnostic test. They're going to have more information about what's going on with their eyes than they've probably ever received before from an eye care provider. The written instruction should be the drops. How do you utilize the drops so you can write it out and tell them what to do? Plugs and what will happen with and what to anticipate with plugs, what to anticipate after the plug has been inserted, and literature on lid hygiene and just chronic dry. So preparing your literature and having that information is going to be so important to your chronic dry. Calling up and ordering the dry eye brochures and the literature on punctal occlusion from Odyssey. Having those permanent plug brochures so that as you see that patient during that first visit, you start perhaps their therapeutic treatment, that you can then set the stage for some of the future treatment, which is included, punctal occlusion is often included.
You know, one thing that I find that really fits well with what you said is how we try to do too much on the first exam, and I think that's important. As we're expanding into medical models and that part of our practice advancing, and I do see that doctors who go into managing ocular surface disease, for example, which is so prevalent, only enhance the number of spectacles and contact lenses that they dispense. But it is really important to know which one they're there for. If the patient comes in with vision insurance, doing a full medical exam will either throw the patient off in terms of what's being covered and how it's not, or number two, you'll do an exam For the spectacles, it turns out the refraction doesn't match up because they had too much dry eye, and until you manage that, we're not going to get a good, refined prescription. So it's really important to take care of one or the other. Is this a vision care exam, or is this going to be a medical exam? And focus on which of those the insurances are involved, or how it's set up. I think that it's important to manage it from that standpoint and then perhaps go to the other when the time is necessary. So doctors have to know that they may have to reschedule the ocular surface disease exam on the medical side, or begin with that and reschedule for spectacles or contact lenses once the dry eye has been managed. So I think they have to go in with that mindset, as you said. I think the other thing that's really important is to have your staff buy-in, which you emphasized. You know, whenever you go and implement new technology, new modalities, this whole medical model, if the staff haven't really incorporated it and adapted to it, it may be quite difficult. But that is a real key component. Now, once they do, I find the staff are thrilled by the fact they continue to learn. There's more education, more opportunities. The questionnaires are really easy for them to administer. You could get those off the website, as you mentioned. They know which forms and handouts to provide to patients, which they really enjoy. I think all of that will only help you to implement it. But those steps should be in place. I would have a meeting with my staff to go over this, to educate them on what dry eye is, what is punctal occlusion, how does it work, so that when they're educating the patient, it's very consistent to what the doctor is doing. And then this will continue to grow and evolve and do extremely well. The billing component ties into that, and the coding, so it's just one seamless step. Now, I don't expect it to be real easy right off the bat. It's a process. There's some learning into it, but those doctors who have taken the steps, especially in something as common as dry eye, will all tell you that it is extremely rewarding from a practice management standpoint, and more importantly, from the impact it's had on their patients.
I really find what you've said about staff is absolutely true. My staff, they get to see the results of a patient being successfully treated. So as a result, they become very enthusiastic. Say that I'm reappointing a patient for a dry eye evaluation. They'll tell that patient what I'm going to be going through, what I'm going to be looking for, and that I'm actually going to design a treatment specifically tailored for their dry eye. And so their enthusiasm can be very contagious. So I certainly recommend establishing a dry eye coordinator, a key person within your practice, somebody that you feel comfortable giving patients instructions, and that could be your contact lens individual, your key individual in another area. Another area that you really have to make a determination, you can use the aid of the Odyssey website to do this, and that is to establish your testing protocol. What are the tests that you would like to run? And that's going to evolve, and that's going to change over time. And also then establishing your treatment protocol, and that is going to continue to evolve and change, as mine does every year. Then as you get down to the actual implementation, you're going to have to modify your appointment schedule. Put in dry eye slots for dry evaluation and dry eye follow-up. And I find they fit nicely, very similar to a contact lens follow-up for those particular time zones. Well, I'd like to thank everybody for joining us for the final section, and actually the total of 5 sections going over the comprehensive treatment, diagnosis and treatment of dry eye disease, and the important role that punctal occlusion plays in that. Paul, do you have any concluding comments?
No, thank you, Doug. I kind of echo what you said. I think that this is a very exciting opportunity. I think you'll find it to be very rewarding in terms of the patient response. And hopefully this 5-module series from etiology and predisposing factors and just the impact on patients' lives as far as symptomatology to diagnosis to treatment to billing and coding, and now finishing with how to begin and get started, gave you some pearls and some insights that will help your practice over the next 2 decades. Thank you for joining us.